Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and Lissa made a found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our content at sptwithme.com for your courses. Now for what you're actually here for, let's talk about the functional reach test. With any functional outcome measure, my recommendation on how to really have it ingrained in your brain is to first understand how to perform it. So let's talk about it. So let's say you have a patient that you feel is appropriate for this test. So standard practice is to have them stand up next to a wall. And if you're lucky, this wall will have a ruler that is just mounted onto it. You're going to ask them to raise their arm or shoulder to 90 degrees. So think about shoulder height. You're going to ask them to clench their fist as you see in this image. Now you're going to note where that third metacarpal is of their hand. Something that I just want you to think about. It is up to you whether or not you want their body to be at where the ruler reads 0, or if you want them to step back so that their third metacarpal reads at 0. You're going to have to do subtraction, so at the end of the day, it's up to you. So what you'll have your patient do is keep their feet steady. They will not move their feet during this test, but you will have them try to lean as far forward as they possibly can, showing how far forward they can reach. So ultimately, as you will see in the second image on the right, you will see that this person has reached forward, and you are going to note where that third metacarpal is. So this is where the math comes in. You're going to subtract the second distance from the first distance. So as far as they can reach minus the starting position. And that's where maybe having their third metacarpal at the 0 centimeters or 0 inches might just be a little more efficient. So you're going to have them do this a total of 3 times. The first time, because it is a trial run, I mean, just think about it. Anytime you do something for the first time, you're not going to be as good. So you're going to scratch the trial run, and you will just average the second and third attempt. So 2 out of 3 of them. Now I just want to give some food for thought. So let's say my patient is at the starting position. Sure, standard practice is to measure at the third metacarpal head. However, what do you feel about a marker that might be on this person's wrist or their elbow or even their shoulder? It's not like if you were to lean forward and reach as far as you can, the fingers would somehow be able to go farther than the elbow or even the biceps, right? So technically, I would say that you could measure your patient at any part of their arm. And this is probably something that you want to consider if your patient has an amputation. You know, just because they have an amputation doesn't mean that you cannot implement this test. Next food for thought. What if every wall in your clinic is taken? Couldn't you just have your patient standing in the middle of nowhere and implement the same exact test? I mean, if anything, maybe you could just bring a ruler yourself right next to your patient, or maybe you can have them stand to the side of a computer of which you know the length of and then measure it based off that. So just because your clinic doesn't have a setup that is identical to what's shown in this image or technically the standard practice doesn't mean that you cannot perform the test. The next thing to do when you're trying to understand a functional outcome measure is to read a little bit on the information describing its purpose. Now, one thing you could do is just read it and try to memorize it. But the best way to really understand something is to think it through. So let's say I have the piece of paper of what the functional outcome measure is for, and I read it. It's going to tell me that it's for the purpose of assessing balance and fall risk. Now, what you have to know is that if a person is unable to reach as far as 10 inches, anything under that difference between the first and second mark, initial position versus the reaching forward position, anything under 10 inches will suggest that they are a fall risk. If they're between 6 and 10 inches, it's a moderate fall risk. And anything under 6 inches is suggestive to be a high fall risk. Okay, so this is definitely something you have to memorize, right? They are numbers. But you should really understand why that makes sense. So if we really break down what this test is doing, you're having your patient stand in a static position. You're going to tell them to shift their weight anteriorly. Now, depending on how well they're able to manage compensating from leaning anteriorly, meaning sticking their butt back in order to keep their center of mass over their base of support, the idea is that you are intentionally throwing off their center of mass. Well, anytime that you're throwing off your center of mass from your base of support, of course you're testing balance. If your patient is not good at keeping their center of mass over their base of support after it's thrown off, then of course it's going to be a test of whether you're a fall risk. Functional outcome measures usually have information on what specific populations might be most appropriate to implement this with. Again, you could just memorize it. You could just memorize that this is a great test for community dwelling elders, non-community dwelling elders, or those who have Parkinson's disease, etc. However, I would like to challenge you to just think about it. Physical therapists are all about assessing a person's functional mobility. So just because a person has Parkinson's disease doesn't mean that, they can't walk or they can't function normally. It could just be a really early stage of their Parkinson's disease. So in this case, they might really excel and reach the ceiling effect of the functional outcome measure. So in this case, applying this test is not really appropriate to implement. Well, obviously, I guess unless you're trying to prove that they're not a fall risk. But that's what functional outcome measures are for. You're trying to prove something. On the opposite side of the spectrum, let's say that you have a patient who has ALS, but you're looking at the populations that are listed on the functional reach test. You're seeing that, ALS is not a population that they've suggested it to be designed for. Well, does that mean that you absolutely cannot use this functional outcome measure for someone who has ALS? I would say absolutely not. Remember that functional outcome measures are implemented to, again, prove a point. The point of the functional reach test is to demonstrate that your patient is a fall risk. So if I feel that upon an evaluation or a reassessment that my patient doesn't have good static balance and in general is just challenged with keeping their center of mass over their base of support when it's knocked off, there should be no reason as to why I can't implement this test to prove that they're a fall risk. I can have someone at the age of 16 be appropriate for this test. Let's say they have a traumatic brain injury. I can have someone at the age of 90 be appropriate for this test. I can have someone at the age of 90 and not be appropriate for this test because they're too high level. So essentially, just always think about what the test is for and how to connect in your own mind how it can help you prove a point, whether it's appropriate or whether it's actually not for your patient. If you enjoy material being simplified and explained this way, check out our courses at sptwithme.com when you're studying for the NPTE. Take a look at this reference for more information.